Oregon Health Leadership Council, or OHLC for short, is a voluntary membership organization that convenes the healthcare community in Oregon. We bring together the health plans, the hospitals and health systems, key medical groups, and provider associations to really do strategic projects together. Going back to 2019, our Medicaid plans were looking at, the research around social determinants of health and wanted to do something together. We have a history in Oregon of working on strategic health IT projects together. And so looking at closed loop referrals was the next iteration of our work together. And so the Medicaid plans were already looking at the vendors and scanning, the landscape. And so OHLC convened 6, I think we called them whiteboard sessions, where we worked with our Medicaid plans and rolled up our sleeves and looked at vendor solutions and talked together. And we landed on the Unitas solution as a preferred choice for our Medicaid plans. OHLC's role then was to work with Unitas to develop a pricing solution that would kind of create a common playing field for all of our Medicaid plans to come into the network. And together we launched what is now called Connect Oregon, which is built on the Unitas technology, in October of 2020 during the height of the pandemic. It started in, I think we were about 14 counties with 9 CCOs. We're now in all 36 counties with 15 of the 16 Medicaid plans, or CCOs as they're known, in Oregon supporting. It was really the technology itself. It was like a well-built solution, people felt. We also liked the United support model, the community engagement, team that came with it. We also felt like Unitas was very much tuned into the national conversations around standards and interoperability, which was a big area of focus for us. And we also were leveraging some pilots that had happened in our state with Kaiser Permanente and a regional system called Samaritan Health Services, who had really good experience with Unitas. So the 1115 waiver is really how we would think about our phase 2 work on Unitas. So if phase 1 was implementing the closed loop referral system, our CCO partners, which are our Medicaid plans called coordinated care organizations, they really looked at the Medicaid waiver requirements and said, we need to expand on our work on Unitas and now have systems to help us screen, authorize, and really pay for these health-related social needs that CBOs are delivering through a common platform. And so again, they turned to OHLC and said, could you convene these conversations? Can we develop some common pricing structures to get us over the line and get us contracted with Unitas for the phase 2 work? So with that, we did that. We now have 11 of the 16 CCOs using Unitas end-to-end solutions for the waiver. And OHLC is also helping to convene a regular, what we're calling Oregon Payments Work Group, to implement common workflows to lift the Medicaid waiver. For us in Oregon as a state, we're really seeing a lot of social needs in our state. We have high rates of homelessness. We have high rates of behavioral health. We have really high rates of food insecurity. And so we really need to address them at scale. Like, we need to get to work now. And by using a common platform and aligned workflows, it just helps us get there better and faster, is the hope.